Federal law now requires insurance companies to cover coronavirus tests at no cost to patients. But as some are learning, the only way to get a truly no-cost coronavirus test might be to go to a community testing site, because walking into an emergency room or into an urgent care could mean getting hit with extra costs. Paul Murphy reports on a New Orleans man who was hit with a huge bill.
The total charge was $913.
New Orleans criminal defense attorney Tim Meche is a coronavirus survivor. He beat the disease, but is still smarting from the bill he got for the COVID test he took at Touro Infirmary.
And when I received this bill for $931 for that, of course I was shocked.
Shocked because COVID tests are supposed to be free to the patient under the Families First Coronavirus Response Act approved by Congress in March. Federal law now requires private insurance companies, Medicare and Medicaid, to cover the cost. But as you can see on Meche's bill, LCMC Health charged him $142 for the test and another $913 for an emergency room visit. While Blue Cross Blue Shield picked up some of the cost, Meche says that's not the point.
I walked through that door that said emergency room. The hospital feels justified sending me this outrageous bill.
We asked LCMC Health about the bill. Clinical and System Operations President Dr. John Heaton admits the bill is wrong, in a statement saying it does not appear to accurately reflect the services rendered. He also said the range stated for lab charges was erroneous, and there is no facility fee associated with the test alone. LCMC is now reaching out to Meche to adjust his bill. Ochsner Health CEO Warner Thomas explains his hospital's policy when it comes to COVID testing.
The testing at all of our community centers is free. There's no charge at any of the community centers. But in our urgent care, or if you get tested in the ER, we look to bill insurance.
Again, COVID testing at the community drive-up sites is free, but buyer beware. If you walk into an urgent care or emergency room, you could get hit with other charges. So it's best to ask up front what you are expected to pay.
And from now on, when I get any health care, I'm going to do that, and shame on me for not doing it in this case.
Paul Murphy, Eyewitness News.
Is some sticker shock. The Kaiser Family Foundation found a wide range of posted prices at large hospitals across the country, from $20 to $850 for a single test.